I think I reflect a lot on what it means to ask for help. I've been thinking about that a lot because I was never really someone to ask for help before.
I found out I had cancer in May of 2019. A big piece of my thought process was, if I have children in the future, will I be able to breastfeed?
When my husband told me that he thought I should join this intensive outpatient therapy program for pregnant women and postpartum women, I thought he was overreacting.
When I finally made it to a reproductive endocrinologist and was diagnosed with unexplained infertility, I didn't really know what to think.
When I had my own postpartum anxiety, that was a big change because I had never truly experienced something that was a clinical level of that required treatment.
Clearly, crying in the middle of the street in the middle of my town and having a panic attack was enough for me to realize that I needed to get help from somewhere. Did I know it was postpartum depression right away? Not really. I just knew that I'd never felt like this before.
Throughout my pregnancy, I had been so intentional about beginning to form strong kinship with other women in my life for the sake of building that community for myself post having the baby, and to not have it in those ways, I think became challenging.
The first thing that I actually did was call the facility that I actually work for, which is a large academic health institution, and ask to get in to see a psychologist or see a social worker, and I was told the wait was 6 to 8 weeks.
6 or 8 weeks doesn't sound like a lot in a lifetime, but it is a long time when you're suffering every single day.
Good evening, everyone. I'm Tina Hone. I'm the Chief Economic Equity and Inclusion Officer at YMCA of Metropolitan Chicago. And I'm delighted to be here tonight with our partners at Partum Health and our distinguished guest. My role at YMCA covers economic equity and truly all the equities that sort of impact our lives, including health equity. And tonight's conversation about maternal mental health is part of that health equity conversation. It is a gender equity issue, and it is a racial ethnic equity issue. At YMCA, we are committed to strengthening community by connecting people to their purpose, potential, and to each other. And that's why this conversation we think is so important, and we're very grateful to be here. Partum Health provides comprehensive services that complement and support the care that families receive from their obstetricians and midwives, including mental health, lactation support, doula services, physical therapy, and more. While tonight's conversation is about maternal mental health, I do want to flag and sort of put a frame on this conversation, which is today the CDC released data about maternal health generally, looking at data from 2022. And what it found was shocking yet not if you work in the health equity space. But 49.5 African-American women experience 49.5 deaths per 100,000 people. That's compared to 19 per 100,000 for white women, 16 per 100,000 for Latinas, and 13.2 per 100,000 for Asian women. That's between Black and white women, a 2.6 times the difference. This is not new data. This is data that's been familiar to me for a long time as I've worked in this space. But as we think about sort of the challenges that we're going to talk about today, I thought it was important, given the timing of that conversation, to put that data on the table as well. And hopefully we'll have a follow-up conversation about how we can make that better. Yesterday was World Maternal Health Day. And I actually wanted to have this conversation yesterday, but speaking of maternal health, my mom was sick. And so she's all better now. She had a great surgery. But it's important, although we're a day late, to have this conversation. Of particular importance is the access to perinatal mental health and mood and anxiety disorder treatments for women in the Chicago area. Wherever you are, whoever you are, there is someone in your life who has been impacted by this, either directly or indirectly. Uh, we're dealing with uh, trying to conceive, whether you're dealing with pregnancy loss, anxiety during your pregnancy, anxiety, postpartum depression, a traumatic birth, whatever your struggle is, infertility. On that journey, there's a level of mental health that all mothers deserve, of mental health support that all mothers deserve. And so what we hope is after tonight, you'll have in your belt a set of tools that can help you as you approach this part of your life's journey, and that you know that it's okay to ask for help. You saw in the video, there were people who were like, I didn't know if I could ask for help. And, we're always toughing it out as women. I will tell you, my mother has like 12-inch cut in her tummy. And she said to me this morning, I'm not a punk, I'm okay. And I'm like, Mom, you got a cut in your tummy. But that is such a woman thing to do, even at 83. And so it made me think about all the women who are struggling here, who, don't think it's right to ask for help. I want to introduce my two amazing guests and the distinguished speakers. I'm going to read this so I don't mess it up. First, I would like to introduce Dr. Melissa Dennis. She is the Chief Medical Officer of Partum Health. Dr. Dennis has been an advocate for whole person care during her 20+ years of practicing medicine. She's held many roles at Advocate Illinois Masonic Medical Center, including Director of Obstetrics, and I thought this was cool. She is a medical advisor for NBC Universal's One Chicago series. Dr. Dennis, can you tell us a little bit about what a whole person healthcare means and why it's so important in the perinatal period?
Yes, thank you so much, Tina. And this is really a great place to start off because you talked about the journey, whether it's an infertility journey or a pregnancy journey, a postpartum journey. And during that time, so much of the focus is on trying to conceive or the pregnancy or the health of the pregnancy and the pregnancy outcome. These are the things that we hear day in and day out. And it's so easy for both the pregnant individual and the care team to forget that there's this entire human being who is an individual before the pregnancy is going to be an individual after this pregnancy. And so forgetting about taking care of that entire person, whether it's the mental health or the physical health, is really a failure in our healthcare system. Why it's so important in the perinatal period? There's a few reasons. Number one, pregnancy can be risky, and so we want to make sure that if there are chronic diseases that are identified for the first time during pregnancy, that we are taking care of those and that we are then preventing other ones that can be prevented. The other is that, it's a captive audience, I guess is what I would say. Pregnancy is the one time in life where everyone has access to health insurance. Most people do access prenatal care. And so if we don't then act upon those diagnoses that are present or really work on that preventative health, then we're missing a huge opportunity. And, then what happens is you deliver and you've seen your OB or your midwife so frequently, and then 6 weeks go by and it's like, hi, good luck. But what about you again? And so that's where that preventative care, whether it's mental health care, pelvic floor physical therapy, working with other specialists is just so important. And that's why Partum Health was founded actually by my co-founder and CEO, Megan Doyle, is that she really just recognized these gaps herself and was like, we must do better.
Yeah, absolutely. I have friends, I struggled with infertility. My friends are on every part of that journey, from late term miscarriage to traumatic birth, and you're supposed to be so happy because you have this beautiful child and you're not. And so I watched so many people struggle with this, and it was one of the reasons I was so thrilled to be able to partner with you all tonight. And now I want to turn to Dr. Nicole Tefera. She is a clinical psychologist specializing in maternal mental health, infant mental health, trauma, and pediatric psychology. In addition to her private practice, Dr. Tafara works as a pediatric psychologist at Advocate Children's Hospital and is a supervising pediatric psychologist at Larabita Children's Hospital, which is not far from where I live. It's very pretty. Dr. Tafara, I wanted to talk about PMAD. We always have
Yes.
these initials.
Right.
What does it stand for, and what do families commonly experience during this period?
Sure. So when we talk about PMAD, we're really talking about perinatal or postpartum mood and anxiety disorders, which is the PMAD piece. The perinatal period that is being referenced here is a time frame defined as during pregnancy all the way through 12 months after giving birth. And so through that entire time period, there are lots of different changes that are taking place, not only physical changes that are taking place, but adjustments to working, to family dynamics, to social supports, to preparing for financially for a new child to enter into the home. And so, um, additionally, if families already have higher levels of stress, that can also be confounded by, worrying or having a lot of concern, or just the process that it takes to get a baby here healthily, right? Because as Dr. Dennis was discussing, it can be a risky circumstance, and that event. Oh, sorry, I thought somebody was walking into my office. And so from that perspective, just a lot of different transitions are taking place, and additional support is highly advisable.
No, I thank you for that. I have to look sideways as my little clicker thing is over there, so forgive me for that. Um, no, it's so important and to recognize what this PMAD is. Dr. Dennis, 1 in 5 women, that's 20% people, 20% of women experience depression or anxiety during or after pregnancy. And a lot of women, like we talked about, feel like we should tough it out, or I'm so happy because I have a baby, and feeling, like they shouldn't, be like this. And so they hide it. It's shame, right? Where's the
Yeah.
line? What is it that we should
Mhm.
be encouraging our folks to do rather than suck it up?
Yeah. Here's what I always would say to my patients. It doesn't matter how much you wanted to be pregnant. It doesn't matter how much you wanted a baby. You might have gone through 10 years of infertility treatments and now have this newborn at home. It is still okay to not be okay, because until you are in the thick of it in that postpartum period, you just have no idea what having a newborn is like, for first time parents. And then the second thing I'll say is these things are biologically out of your control. A lot of the things that contribute to postpartum anxiety disorders and postpartum depression. So, don't feel like you should be over the moon at all times, because that's probably a very unrealistic expectation. It's okay to cry. I don't know anyone who's made it through the newborn period without some tears of frustration, or, some worrisome thoughts of, am I doing this right? And that's all very normal. What I'd say, is like, at the time to seek help is if you're crying all the time, if you could sleep because the baby, but you can't, you just have these racing thoughts. If you can't eat, if you feel like you're not caring for yourself or for your loved ones well, these are reasons that you might want to seek additional help, or think, oh, maybe this isn't just the typical baby blues that I've heard of. Maybe I'm crossing over to something else. The other thing is looking at the time from delivery and how long these symptoms are happening. Once you cross over that 2-week mark, most of those baby blues should be resolving. So if you're really still having symptoms that are significant, again, time to think, all right, it's time for some extra help. And, it's time for me to reach out to my midwife or to my OB and see if there's something else that is going on. The last thing I'll say is, and I think Dr. Tafera is going to go into sort of the spectrum of perinatal mood and anxiety disorders further, but of course, if you have any thoughts of hurting yourself, of hurting the baby, of hurting anyone else, that is a do not pass go. You need immediate assistance, you need immediate attention, and there is still zero stigma in that. There is nothing that you can do for yourself at that point other than get the help you need. So please, please, if any of that is happening, that's like you need immediate help. Don't wait until the doctor's office is open. Please call us immediately.
No, thank you for that. Because, postpartum depression can be lethal and people don't realize that,
Yes.
you know? Uh,
Yeah.
and it's
I
not
mean,
just
oh, I'm sorry.
no, no, go ahead. Please, please.
No, I was just going to say maternal mental health or disorders are the number one reason for maternal death within the first year of delivering. And that ranges from depression, from, to suicide, to drug use. And so, this is not uncommon. This is something that it's really important for us to be having this discussion.
No, absolutely, absolutely. Dr. Farah, and it's
Mhm.
not just baby blues. Women can suffer from other mental health issues after birth. Can you go into that?
Absolutely. And I think part of the fact that about 80% of women actually do experience baby blues, it is also like normalized in a sense that, oh, this is just the baby blues, you'll get over this. And so one of the challenges becomes when a woman is not getting over this, right? And when the symptoms are feeling more persistent and the symptoms are impacting the mother's ability to, like Dr. Dennis was saying, eat or sleep or function well or take care of the baby. And there is a spectrum of conditions. Particularly depression and anxiety are the most common of the PMAD spectrum. However, some symptoms can become so severe that women can develop panic disorder, panic episodes, obsessive compulsive disorder, post-traumatic PTSD, particularly if there's a traumatic birth or the mother has a prior history of trauma, they're at greater risk. Perinatal bipolar can occur again with pre-existing condition of mental health condition, and then you have the like psychosis part, and that is very acute, and that comes on in a very acute onset and does require immediate intervention. So I think one of the messages to be able to communicate is that, after 3 to 4 weeks and there are symptoms that are still persisting and the mom is not feeling really any resolve, they're beginning to feel a little bit more hopeless or more irritable, more frustrated, more restless, loss of interest in doing things like, spending time with the baby or doing things that they used to enjoy or just even taking care of themselves, fatigue, energy difficulties, trouble sitting still. These are all signs that you need to reach out for additional support. And I do think that the point that you made earlier, Dr. Dennis, is like, okay, you spend so much time seeing your physicians throughout the pregnancy, and then you have your post delivery visit, and then it's like, okay, see you later. So I do think that another opportunity is when you're taking your baby because it shifts and you're spending more time with the pediatrician, right? Because you're making sure that the baby is getting vaccinations or maybe the baby needs their regular visits more frequently. That's also a medical provider, healthcare provider that you can be touching base with as well to outline your concerns if there are concerns present, not only your OBGYN.
And this is a question wasn't on our list, but the point you just made about the pediatrician also watching the mother, is that a common practice? I remember I mentioned, my best friend's a physician. She's like, if it's not on the boards, you don't learn it. But is it something that pediatricians have gotten good at?
Yeah, I definitely think, after, the mom brings the baby in for the very first visit, the family brings the baby in. I think there's so much attention that is paid to the baby, but also to the mom, and the other partner is kind of sitting there like, okay, well, but I might be struggling too, or this is hard on me as well. Um, and I think after that initial visit, it may not be a topic that comes up, um, that a pediatrician is reaching out and asking the mom how they're continuing to do. And it might be a missed opportunity sometimes, even though they may have brought it up the initial visit, because the follow-up visits are about what is your baby doing? How is your baby doing? How, is your baby meeting specific milestones, as well? And so I do think that we have done a lot better on the pediatric side of things, with asking, the parents, but I think we could do a lot better on the pediatric side.
Yeah, I used to work in healthcare policy. I feel like a health insurance, like give me a code for a pediatrician to take care of mom.
Mhm,
Things might happen.
mhm,
I want to ask both of you, what are some of the things that a woman and can't hurt lead her partner? Because she didn't make that baby by herself.
mhm.
Like, what can they do and she do as they head into this perinatal period to get ready and maybe understand that this could happen to them, so that they know, wait, they said this could happen. Let me get help.
Yeah. Um, I'll jump in first, Dr. Tafera, if that's okay.
Sure.
I think you're going to hear the word come from me a lot, prevention and awareness. Like those are two of my favorite words. So, number one is, for everyone who's here tonight listening to us, kudos to you. Because if you're not currently pregnant, at some point in your life, you will know someone who is. And so you're going to talk with them about prevention of perinatal mood and anxiety disorders and how important it is. So I think we're making a huge step here and that we're acknowledging it. I also think if you know you are someone who has a history of depression or anxiety in the past, even if maybe it was as an adolescent and it's something no longer that you're, experiencing, if you know your baby's going to go to the neonatal intensive care unit for some reason because of X, Y, or Z, we know that certain things do put people at a greater risk of perinatal mood and anxiety disorders. So start care with a therapist preventatively. Get that person on your team, bring them to your side so that, let's say postpartum you are struggling, that's not the time that you are trying to find someone and you're establishing a relationship. You're already tucked in. Um, so that's one of the biggest things that I will say, is prevention. And then awareness, it's just that everyone be aware that this can happen. It can happen to the partner, it can happen to the birthing individual. So your entire support team should be looking for this and looking for these signs and symptoms of these, because sometimes the person who's in the thick of it is the last person to recognize it. And so, you want other people who are your loved ones in your support system who are like, hey, I think that maybe you are suffering from postpartum depression. Let's get you the help that you need if you don't recognize it. And then the last thing I will say about setting up that team is that team might consist of people other than a behavioral health provider, meaning if you know that you plan on breastfeeding, and I think we're going to get into this some more a little bit later, but if you're having significant breastfeeding struggles, then that can negatively impact your mood and put you at risk for having postpartum depression. So get all of that support set up while you're pregnant so that postpartum kind of already have it in place and you're good to go. Or I should say, I am the mom of two kids. So when I say good to go, I should say as good to go as you can be, as you're about to enter this like totally controlled chaos part of your life.
Yeah, children. I used to teach 8th grade. That was enough. Dr. Tafara, something that would you like to add anything? Tafara?
I agree with everything that Dr. Dennis said. I think what I'm happy to see is that there is more access to information via social media, and online. And so I do think, trying to just gain as much knowledge as possible, and also attend or yeah, become a part of support groups if that's something that people find beneficial, because sometimes it can be stressful also only getting support from within your family of origin, depending on, sometimes moms talk about not feeling like they're doing a good enough job because maybe grandma says you need to do this with the baby, or but you read a book that says you need to do this with the baby. So there's also so much information that that can be conflicting, and it can be disorganizing for moms. And so it's really helpful to establish a support that moms have control over, in a sense where they can decide if they want to be a part of that support or not, and they can actually be vulnerable and get tips or pointers and decide whether they're going to choose to use those tips and pointers from other moms, and not feel like they're not listening. So I think that that's another key piece that I would really highlight, is establishing your own built support system.
In all parts of life.
Right.
So data shows that about 25% of women do in fact get proper perinatal care about their mental health. But 25% is not a lot. And if we disaggregate it by race, I'm putting money that Black and brown women are getting very, very little of this help. And then I'm also putting money on what we call care, could be something less than the right kind of care. Could you two sort of elaborate on that? Because I'm just guessing. I'm not a real professional. This is just instincts for me.
Absolutely.
Dennis, you want to start?
Yeah.
Sure, I'll get started. You're right, it's a really low number. And when we look at, 1 in 5 women being diagnosed, that's probably underrepresented as well. So you're looking at a huge percentage of people who have one of these perinatal mood and anxiety disorders who aren't getting proper treatment. Why it happens is really multifactorial. One, there is still stigma attached to, mental health. We are trying so hard to break that stigma, but it exists nonetheless. So people are not always forthright when they get those questionnaires. They are getting them at their postnatal appointment. They're getting them during pregnancy. And, we know how to take tests, right? Like, what answers you're supposed to be giving on these to make it look like everything is okay. So a lot of people do not, necessarily put the correct information or the truest information on there. Two is, while therapy can help for most people, some people would benefit from medication, from a different therapeutic intervention on top of therapy. And I think that there's still a large misconception of those not being safe if you are pregnant or if you are lactating. And that is not true. There are a lot of antidepressants or anti-anxiety medications at this point that have been very well studied during pregnancy and especially in lactation. So you don't have to suffer if you're finding that what you are trying is not working. So you can definitely talk with your provider about getting a prescription for an antidepressant. And then lack of resources. There are more women who are experiencing postpartum depression and perinatal mood and anxiety disorders than there are psychologists and licensed clinical social workers. And so it is, we are keeping everyone's schedule full, but, just not everyone's going to be able to access the care that they need in a timely manner. To go on to your comment about disparities, 150%, you are correct. So in women of color, it takes longer to make the diagnosis, it takes longer to get an appointment for appropriate follow-up. And it goes back even to those screening questionnaires. These questionnaires were validated on white women. And so while we use them in women of color, we don't really know if the same scores that we use are appropriate for someone to make the diagnosis of postpartum depression. And you might even have a physician or a midwife who doesn't recognize that they should be using then a lower threshold for making the diagnosis. So that problem is so multifactorial, and it goes all the way back to your very first comment of healthcare disparities for women of color who are giving birth, and it not being as safe for them in the United States as it is for a white woman such as myself. I'm gonna ask Dr. Tefera to tag on to that, because I'm sure in your experience working as a psychologist, you can even add more than what I've seen as an OB.
Yeah, absolutely. And I do want to highlight the disparities, particularly with Black women, because the 60% of pregnancy-related deaths we know are preventable. 40% of Black women experience maternal mental health symptoms. 3 to 5 times more Black women are likely to die from pregnancy-related deaths compared to white women. And perinatal mood and mood disorders are the leading complication of pregnancy and childbirth. And so you really think about what is the Black woman's experience as they are navigating pregnancy in the healthcare system. And then you think about what if they need additional support from a mental health professional. And depending upon perhaps general trust or distrust of the healthcare system, that may determine if the mother is going to reach out for mental health support within the healthcare system. I think the other thing is access to treatment becomes challenging due to lack of time to get screened because maybe someone has to return to work. Maybe there's no childcare resources that are available. Maybe there's transportation limitations. Maybe there are language variables. Maybe there's unaffordable mental health care because sometimes your medical care coverage has a separate carve out for mental health care and lack of access to quality mental health care in the community. And so if you have community mental health facilities that can provide resources to under-resourced or underinsured individuals, the waiting lists are 6 months to a year long, and therapy is expensive. And so if you're wanting to, connect with a therapist that's in private practice, oftentimes they don't have the ability to do no cost services. They may have the ability to do sliding scale services, but that still may not be affordable for some families. So I feel like there's a lot of institutional or structural barriers that make it more complicated to get, healthcare in general, let alone mental health care.
You know, uh,
Oh, you're on mute.
so I'm the daughter of a Black woman.
Mhm.
And when I think about my mother, 21 years old, right, was poor, you know, interesting relationship with my father, it's like, and how many sisters now are still in that same place? Like, I'm having this baby, there's all this stuff going on around me that was already going on around me.
Yep.
And now I have this happening to me.
Mhm.
It's an overwhelming burden for, I think, all women. But when you look at the struggles that Black women face just as an ordinary part of life, there's a particular pain, there. And again, the lack of accesses and resource and this mythology in our community, don't be a punk, right? Like,
Mhm.
tough it out,
Mhm.
you
Mhm.
know?
Absolutely.
We talked a little bit about breastfeeding. It can be incredibly challenging. And you feel like inadequate because you can't feed your child. I mean, so many things that poor mothers go through. What are some of the lactation supports that can happen? I know it's a little bit of a sharp term, but I'm over time, so I'm like,
All right, then I'll try to keep it really brief. What I'll say is that, there are actual studies that link, challenges with breastfeeding to postpartum depression and pain with breastfeeding to postpartum depression. And it makes perfect sense if you think about it, right? Because we need this hormone oxytocin, which is the love hormone, to be released to create breast milk. But then you have these high anxiety hormones, and those decrease your oxytocin. So then you're not making enough milk. So then you're stressed, and you see where this vicious circle goes. So it's really important to kind of break that cycle of anxiety and fear and pain that goes along with breastfeeding. Um, Part of it is in preparation. And so, having realistic expectations of what breastfeeding might look like. And two is bringing in a lactation to a lactation consultant to be part of that team. You can meet with them beforehand so that they can provide education and kind of set you up for success. But then bringing someone to your home or working with someone in the hospital, after you've delivered is also really important. Because people who do get intervention, if they're having pain with lactation, actually it's statistically shown to decrease the risk of postpartum depression compared to women who don't have that early intervention, to meet those breastfeeding challenges face on or head on. So that's what I'll say about breastfeeding is just when you're thinking about putting together that team to take care of all of you for your mental health, just don't minimize the impact that breastfeeding challenges can have on your mental health.
No, thank you for that. Dr. Tefera, someone's watching tonight and you want to give them a piece of advice, like what can you do on this birth journey? What is that advice?
I would say what you can do is try and educate yourself as much as possible. Connect with communities through social media, talk to your friends, talk to your family, talk to other mothers. Um, don't be afraid to talk about some of the struggles that you're having. Each pregnancy journey is different. Having more than one child, each one of my pregnancy journeys was very different. And I experienced postpartum depression and anxiety in my first pregnancy, in the perinatal period, but not at all in my second pregnancy. And I actually felt very prepared to go into a second pregnancy with the knowledge that I gained in my first pregnancy. And so knowing that this is something that is not uncommon, it can happen, it is treatable, and that reaching out for support is something that can be very helpful. The worst thing that you can do is isolate and suffer in silence, because your mind starts to make you start thinking all kinds of things like you're not good enough, you're not doing this right, why can't I do this, does my baby love me, I'm a terrible mother. And then you start spiraling into a pretty dark place. And so I would say that is the number one thing to notice if you're isolating yourself, that's something that you want to stop. Mhm.
Lack of sleep, right? You've got a newborn and they're crying, and that's another big stressor. Dr. Dennis, what can you say to moms who are struggling with the lack of sleep?
Yeah. I mean, I wish I had magic for that, and bottle it up and give it to every new parent. One of the things is to get that support lined up. If you can, think about working with a postpartum doula, to help during those evening hours. You can talk about, maybe bringing in family, loved ones, friends who, instead of getting you that gift, say, can you give me the gift of 4 hours of uninterrupted sleep? Because honestly, babies need very little, instead of like a room full of plastic toys. And then, the reason I bring up postpartum doulas is they are amazing. But like Dr. Tefera said, every family has different family dynamics. And so you might not want your mother there or your mother-in-law there or a sister. That might actually cause more stress. So just keep in mind, those other outside resources. The other thing I'd say is if you're going at this alone or, with a partner, remember that this too shall pass. It feels like it's forever when you are going through it and you wonder, what have I done? But know that it will end and this child will get to a point where they sleep. Try to keep lights dim in the middle of the night. If you're waking up to feed the baby, try not to scroll through your phone. So much evidence says that's not good for any of us, but definitely you want to do whatever you can to try to stay as asleep as you can during the night. And then nap during the day. So babies are up a lot at night, they're cluster feeding. So this is not the time to be worried about a clean house, about writing thank you notes, about entertaining others, about any of that. This is sleep when you can, rest when you can. That is kind of like your number one priority, that you and the baby eat, that you and the baby sleep, and that you and the baby are, bonding. Those are kind of what I would say are those top priorities right then.
No, that's so helpful. It's I think experienced mothers, like you were saying, Dr. Tefera, like your second pregnancy, you had this. That's what happens, ponytail top of my head, I don't care. Like,
Right.
babies
Absolutely.
survive. I want to open up to questions. We have a few questions. We have, I think, one in the chat and two in the Q&A. So I'm going to flip back and forth. And of course, I'm completely over time, but here we go. The first question is from Judy Friedrichs. Stigma of diagnosis of PPD and fear of losing their child, so they are not honest in responding with to screening. I thought of that too. Have you experienced that? Have you seen that? Yeah.
Absolutely. This goes to the, knowing how to answer the text questions and not being honest with that screening, and definitely, the fear of losing the child,
Yep.
far more so in, Black women, brown women than, again, that goes to the delayed diagnosis and the mistrust of the healthcare system. And I'm not saying it's misplaced mistrust.
Yep.
So yeah, we know that happens. But it's hard because sometimes it could be staring me in the face as the OB. And I'm like, I feel like something is, wrong, and I want to help. And, unless people are honest, and it doesn't have to be with me, but with someone they trust in the healthcare system, to get them the help they need, I think that's the most important thing.
Yeah. And even if they're honest with a friend, right? I'm feeling something
Mhm.
bad here.
Yep.
And
Yep.
that friend can then be your advocate, Um, there is another comment from Brenda Papierniak. I should be able to do that. And it's a comment, not to mention that not everyone who works in the community of mental health has the right training specific to perinatal mental health concerns. Dr. Tefera, do you want to, comment on that at all?
I agree 100%. I think as somebody who was trained and had more of a specialization in children, adolescents, and families, when I was going through my training decades ago, I did not get any training in my academic program in infants. And it was like infant mental health, like what is that? And I also didn't get any training in perinatal as well. And so I think one of the things um, that we do have to do is to keep up with our licenses. We have to do continuing education. And if you're noticing that, within community mental health or wherever you work, that, this population is needing additional support, then I think advocating for within your work environment to get CEU training, to try and get also free training as much as you're able to be able to, you know, continue developing as a clinician, as a mental health professional, as we're learning more and more and becoming more advanced in understanding different mental health conditions. I think the thing about perinatal mental health that is helpful if you're a trained mental health professional is that the diagnoses, the depression, anxiety, OCD, PTSD are very similar as the general mental health condition. It just so happens that the parent is, pregnant or postpartum and they're experiencing it. So while it does seem like, oh, this is a very foreign territory, I think with consultation from colleagues and ongoing continuing education, I think that one could be able to bridge that gap.
There are two really good questions in the chat, and they're not really good just because they're from my boss, but they're really good questions. One is, and I was thinking about this too, you have neglect cases. And is there a recognition that postpartum depression could be part of that neglect case? Have you even seen trends like that?
I think it's complicated. And the reason I say that it's complicated is that, you know, I cannot say that I have directly seen a case where a child who has been neglected is specifically from postpartum perinatal or postpartum. I think that there's a lot of other factors that may have been at play and in motion before it got to that point where lack of access to care or just even an understanding that a parent was experiencing clinical depression or substance use or maybe they were in a interpersonally violent or unsafe relationship that there's a lot of different factors that I think gets to a point where a parent is unable to care for their child because inherently and biologically we are not wired to be neglectful, and so there's a lot of different psychosocial or mental health factors that are contributing.
It's sort of the point that you made, Dr. Dennis, that you're bringing in sort of these layers of things already, and that sort of is a marker for postpartum depression being something that can impact you. And I'm gonna ask you, Dr. Dennis, this one. What can we do to encourage obstetricians to immediately recommend, like, sort of a therapist as part of the care team?
I will say that that is my mission right now, and every OB office I go to, I am talking about this. Um, you know, ACOG, which is our guiding college, is making good steps in trying to make this happen. It always takes time from any time you get from legislation or changes at a college level to then implementation and then full acceptance. But this should be, if I had my choice, there would be a therapist, a psychologist sitting in every single OB's office, and you'd be able to go next door and you'd be able to get that visit, whether you think you need it or not. And then if you are diagnosed with anxiety, depression, they're right there for you to initiate treatment immediately. So I think it's in conversations. I think that it is in encouraging people to adopt recommendations that are already in existence that, maybe they're not the priority, when they're looking at their office day. It just, is something that's easier to brush by the side. And then I would say in patients bringing it up also. I'm hoping that we're talking to a lot of people here tonight who will then bring it to their doctors or their midwives, because if we know you care about it and it's something that I get asked all of a sudden, at lots of visits, I'm going to be far more likely to bring it up proactively at every visit, than I am, if it just seems like it's something that's not concerning to the patient. So yeah, it is something that I am doing. I am going out to offices all the time and I'm like, you want your patients to get this preventative care. It is so, so, so important. And everyone agrees. The great news is everyone I've talked to agrees and, really does want to get their patients the mental health care specifically that we know that everyone needs.
Well, you have a fierce ally in the YMCA of Metropolitan Chicago. And I really very seriously say
Excellent.
this under the leadership of our CEO, Dory McWhorter. Gyms and swims are super important, so I don't want to diminish that. That's fitness and health. But we are committed to being a hub in the communities where we are helping to deliver to the people in the communities the things that they actually need. And so we may not be psychologists, but perhaps there's some support groups we can put together. But my brain is moving, and I know everybody in our teams, because that's what we do at the YMCA of Chicago, Metropolitan Chicago, our little brains rock. So I want you all to leave this call knowing that you've got a fierce ally with us. This is our skin in the game, is to, this is the type of thing that we care about, to make sure everybody has access to the care they need and the supports they need. That's our mission, and that's what drives us. Before we conclude, I wanted to give both of you a chance to share some closing thoughts. And so, Dr. Tefera, I'm going to go with you, and then I'm going to go to Dr. Dennis.
Okay. I just want to thank you for inviting me here and inviting Partum Health here, because I think this is such an important matter to be discussed. And I'm glad that it's being more openly talked about because that reduces the stigma. If anything, I can just continue to, I guess, highlight how important it is to see mental health as part of overall health. Like there's not a distinction that when a woman is getting cared for in their pregnancy, that part of that care includes their mental well-being and that helps them and their baby. And so I also put in the chat some numbers for, different postpartum support groups, or if moms feel like they're in crises as well. I'm not sure if everybody can see that, but that's something that I also want to just leave folks with as well, because, maybe feeling timid to reach out to, a medical provider, but you can always reach out to these support groups as well to get access to and just to talk about what concerns you may have or if you think you may be dealing with this.
And that could even be a follow-up email that we send to all registrants,
Yeah.
right? That here's some key information, and YMCA Chicago is also going to have information on our website. So I'm so grateful for you sharing those resources.
Sure, of course.
Dr. Dennis?
I am going to echo Dr. Tefera and just say thank you so much for partnering with us for this, because these conversations are so important in decreasing the stigma. And if even one person here tonight who is listening either identifies something in their set themselves or someone else, then we have been successful this evening. So thank you for joining us. As far as my other closing things, I'd say, again, what were my 2 words? Preparation and knowledge. So, just be as prepared as you can be, learn as much as you can going into this, know the signs and symptoms. And then the last thing that I'll touch on that we've kind of talked about a little bit, but not fully, is to advocate for yourself. If you feel like you're not being heard, if you feel like your physician or midwife just isn't listening, if you feel like you're not getting the help that you need, even when you feel like you are screaming it, like, I need help, just keep doing it. No one knows you better than you. So, don't let someone else tell you that you are okay when you know that you are not. Just keep pushing to make sure that you're getting the help you need. And if it's not with your current physician, you're not married to them, go find someone else who will listen to you. Bring someone else with you who can help advocate with you. And, really just make sure that your concerns are heard. So, I'd say those are the things that I would want to leave people with this evening.
And I thank you for that. And don't be ashamed to say that you need this help.
Mhm.
Because I think shame prevents people from asking for help. I lost my husband to suicide, and I believe that he was ashamed to say what
Mhm.
he was thinking. And so I want people also to know if they're thinking of hurting themselves, to call 988, that National
Yeah.
Suicide Prevention Hotline, because there are resources now that were not available
Mhm.
when my husband was in his crisis, and I want everyone to access that. I want to thank you again for allowing us to partner with you this evening to have this incredibly important conversation. I hope that we will help people. I'm sure we're going to post this on our website and make sure the whole world sees it. And I hope you'll be able to share it as well. So thank you. Thank you for allowing us to be on this journey, and to everyone who was participating. Thank you for being part of our audience and participating in the conversation. Everyone be well. Thank you.